We are very happy, APCOM, to have you in our series for the newsletter about the COVID. Uh, Mona Lee is in this interview. Can you please introduce yourself a little bit to the audience?
Hello everyone. I'm Monali. People also know me as Mahnoor Chaudhary. I'm working as a director program in a community-led organization. That name is Khwaja Sera Society, which is a community-led and community-based organization. I'm working and running this organization since 2012. Basically, we are working for the transgender people, especially on their health capacity building and on their rights. And other than that, now we are also working on the community system strengthening and make the community empower by providing them the capacity building training and psychosocial support. And recently, I got elected also as a executive board member of ILGA Asia. ILGA Asia is a Asian network, and everyone is familiar with that network. And other than that, in Pakistan, I'm also a member of the technical core working committee of Election Commission of Punjab, and I'm also working with the collaboration of National AIDS Control Program, and I have developed and provided the technical support to a National AIDS Control Program in developing the SOPs to implement the service delivery model of community-based organization. And yes, we are also working on the implementation of the Transgender Protection Act, the act which was passed in 2018 May, and now we are working in drafting the policy with the closely collaboration of social welfare and Punjab Social Protection Authority. And for that purpose, we have developed some strategic advocacy toolkit and some sensitization training guidelines to sensitize the key stakeholders to create the kind of enabling environment so the community can get the basic rights without any stigma and discrimination. And that sensitization toolkit is for the healthcare providers and for the law enforcement agencies. And yes, now we are also providing the health services to the community regarding the HIV/AIDS, STDs, COVID-19, TB, Hep B and Hep C, and yes, recently I got awarded from APCOM as a community hero in 2009.
Before COVID-19 happened, what was your life like? Was there a lot of things you were planning for 2020 for work?
Yes, before COVID-19, there's a lot of representation on international level in which we have planned with the health ministry to represent ministry and government data in different platforms, specifically in International AIDS Conference. And we have also like designed some community-based small programs in which we have decided to provide the care and support to the transgender people, specifically those who are the PLHIVs. And we were also decided to start some initiative for the transgender people for the formal and informal education. That was the planning specifically for this year. But yes, because of the COVID-19, all planning has been changed and all plans have been rephrased, and we have invested and we have changed our all project implementation plan towards COVID-19 and its aware.
If when the COVID happened, how did you respond? Did you adjust quickly or did you have to make a lot of changes? And can you give examples?
Yes, actually, we are living in the Pakistan, which is like still a developing country. So we have a very limited resources in our government reserves. So what we have, what we took initiative initially, we have immediately. assigned the administration task to close down the all CBOs, all the organization, community-based organization offices, and ask them to work from their home on the rotational basis. But as we are working for the deprived community, which is the transgender community, and we have decided to serve them even during COVID-19, and we have decided collaboratively like who like need to come at office and when. But yes, it was decided on the basis of the rotation. So, and the initially lockdown was announced by the government is from the March till April 15th, and till that date, our office was also closed because the government has passed an article under the law. No one can create a gathering and kind of social gathering and all that. So that's why till 15th of April, all community-based organizations were closed. And after that, after having the discussion and after got the approval from the health ministry, we have decided to work with the ministry and for the transgender people. And for that purpose, like initially what we did, we started to do the locally mobilizing the resources from different local donors and NGOs, and ask them to provide us preventive tools, at least to start our service delivery through our outreach workers to reach out those community members who are most deprived when even in this COVID-19. And our outreach workers went to the daras of their community and provided them the awareness and preventive tools, the personal protection equipment, which contains the sanitizers, masks, gloves, soaps, and all that. And we have provided to them. And yes, this community is like very marginalized one and very vulnerable because they don't have the opportunities to earn their money and to like earn for their bread and butter and for their survival. So they just do begging functions and sex work. And because of this COVID-19 and lockdown situation, they were unable to even get the money through these sources. And that was one of the reasons the community will even not have that much power to um, fulfill their basic food needs and all that. And for that purpose, we run the social media campaign, and we have asked for the donation from the people, from the donors, from the local NGOs, and we got like very good amount of funding. And we have made some nutrition bags for the transgender people, and we reach out to their doorsteps and provided them the food packets, so they can like they can have the food and all that. And um, uh, and during this situation, the one of the like affected population among transgender community is the PLHIV client, because PLHIV clients, the people, the transgender people who like get infected with HIV, they are not even willing in COVID situation to go to the government treatment center because of the fear of the coronavirus, because of the fear of the COVID-19, because the fear of get infected, because as comparison to the normal people, the PLHIVs have lesser immune system as comparison to the normal people. So they have fear, and they were not even willing to get their ARVs to by visiting the government center. And we have started the advocacy with the Punjab AIDS Control Program and some government treatment centers to provide the ARVs to PLHIVs at their doorsteps. And our outreach workers did a very great job for the PLHIV clients, and they just provided the ARVs to all PLHIV clients at their doorstep. There's a lot of things which I need to highlight, like what kind of challenges community is facing, because the community is earning money through bagging. And even during the lockdown, when they go out for the bagging, the law enforcement agencies like harassing them more. The transgender community have faced more violence as comparison to the past situation, and like they were like even in that situation, um, they didn't have even that much power to pay to pay the cost of even for their houses as a rent.
Can I ask what impact it had on your life, on your personal
Uh,
life? How
okay.
how did you adjust to COVID situation, Monali?
If I talk about my life was like totally changed in a way, like because we are the service healthcare service providers, and we are like more vulnerable as comparison to, in terms of the like risk and all that. So by avoiding and by like keeping this all thing in my mind, still we were passionate to serve to the community. And but yes, because I'm the educated one, and in our country, in our country in Pakistan, the transgender community is not educated one. So I'm the privileged as comparison to them. So I'm already aware what kind of preventive tools I need to adopt before go out, and before go out to the daras, the places of the community, and to serve them. And yes, my workload is like now very high. The responsibilities are now like going higher and higher. But yes, the social distancing was one of the like effect in the transgender community, because we as a transgender community live together. So in a very small spaces, we live together, like 5 to 6 people live together. So one of the like major impact of the COVID-19 is that like we were even unable to meet everybody. We were unable to live together because of the situation. And um, yeah, this is one of the like major impact. And yes, um, the workload, the pressure, the responsibilities have been increased now. And yeah.
What are the worries for the community for the future?
Actually, still community is more worried about their survival. Survival in what sense? Like this community have their own source of income, and this community, although yes, we have a transgender protection act, but still the Pakistani community is reluctant to accept the transgender community. They are more uh, like they're more like accepting the community of male and female. They're not even willing to accept the community as a third gender. And this is one of the major reason our government has announced the multiple initiatives during the COVID-19, but even not even in single initiative the transgender community was included, because all initiatives were based on the verification of computerized national identity card. And our transgender community is still struggling for the computerized national identity card, because of still the policies are not available under the authority of NADRA. NADRA is a professional body which is responsible to provide the national identity card to every citizen of Pakistan who are living in the country, but they don't have the policy to how to make the CNSC for the transgender people. So all the initiative were taken by the government is based on the CNSC verification, and those transgender community have CNSC are not even willing to share their CNSC like details, because many of the transgender communities like gender male mentioned on their CNSC card, so they are not even willing to disclose it. And this is one of the reasons like they are very worried now. And many owners of the places are now asking the transgender community to leave their places because they don't have now power to pay their places rents. So the one of the major issue is now the place issue the community is facing. The other issue is that community live together, and the 4 to 5 people are live together, and it is very difficult to maintain the social distancing, and it is very difficult to save them from the COVID-19, because if someone is go out for anything, for like earning for something else, then that the same person, if the same person came back in the same place, and the rest of the remaining 4 person are might be on the risk because of the one person is like not taking the preventive measures. And the third worry of the community is that like community is facing a huge challenge of the financial issues, because they don't have now opportunities of even sex work, of even bagging, or even dancing in functions and all that. So they are facing the financial challenges, and they are not even that much resources to buy their basic foods and needs. And one of the major concern within the community is about for the PLHIVs. The PLHIVs, yes, the government took the initiative to provide them the ARVs at their doorsteps, but what if they don't have um, food to eat? So how they can intake the medicines without taking the food, without having the food? So this is the like main worries within the community.
If you could ask for one service that you need right now the most, which one would it be?
Um, I really want to I really want to initiate a service, and I really want to ask for the local fundings and for the international fundings to provide at least care and support and food services to the PLHIVs, because PLHIVs is like at very high risk now. We need to like focus on their foods and on their nutrition if we want to work on the prevention and treatment system to reduce the prevalence rate of HIV in country. So the first initiative would be I would recommend the treatment care and support for the PLHIVs. The second initiative would be we need to focus on the corona symptom kits medicines. We need to develop some packets which at least contains few medicine which can um, cover up the basic symptoms of the corona, and we need to distribute through outreach in among our transgender community by visiting their data, because at least if they, because the our healthcare providers are treatment centers, even our government hospitals are not even sensitized and not even willing to treat the transgender community in normal situation. But now it's COVID-19, so the community is also not willing to go at any government center because of the fear of the stigma and discrimination. So at least they have some kind of medicine to deal with the basic corona symptoms if someone get infected with corona and all that. So we need to provide this basic like medicine kit to the community so they can protect themselves if someone get infected and with corona.
Do you think because of the COVID there are certain lessons that we learned? Or did you learn, or the organization or your communities, are there certain lessons that the COVID taught us?
Yes, what I have learned because of the coronavirus, we always need to make the contingency plan for the organization and for the community at larger level, because like the corona it suddenly happened and we didn't have that much plan in terms of the resources, in terms of the fundings, in terms of the other safety measures. So what I have learned because of the corona, like we need to make every year based on the forecast basis or based on the assumption basis, we need to make the contingency plans for the organizational level, for the community level. And other thing is that we need to what I have learned, like we need to discuss with our donors, like we need to adopt always a flexible approach to use the funds on the base of the needs of on the like on the like it should be on the need based. So our donors need to be flexible, what I have learned. Our international donors are flexible, but our national donors are not that much flexible, um, as what I or my organization was expected, and they are not that much flexible. But yes, international donors are much flexible than the national donors. So what I have learned these two things during this COVID-19.
Are you about the future even if the corona continues now that you have to adjust?
Obvious, like we need to change little bit our lifestyle if we need to protect ourselves. Then we need to change our lifestyle, and it has been changed already. And if being a service provider, this is my kind of advice for all service providers, either they are from the community or from the outside of the community. If you want to serve to the community or marginalized sector or any vulnerable population, then you need to focus on your security first. After that, you can save the other peoples who are expecting something from you.
I don't know if I asked, I just wanted to ask you a final question. Munali, it was really interesting. Are there other issues that you would like to address for, you were talking about HIV, but also for the transgender community, are they at a high risk? And can you explain, if so, the issues they are facing, like transgender community?
Yeah. Um,
Is it different than the
uh,
PLHIV?
yeah. The one of the like major issue, the PLHIVs and the almost rest of the transgender community is facing in this pandemic is the stress. The mental health issues the transgender community is facing because of the stress of this pandemic, and they really need some psychosocial support, and they really need some counseling, like from anywhere. And because of this mental health issues, community is like suffering from the depression, anxiety, and even community is more involving in the substance use. And because of this substance use, community's health is going day by day is down, down, and down. And even like what I have seen, because of the lockdown situation, those transgender community who are sex workers, their clientele are now is very limited. So those who came to their places, and if that client is denied to use the safer sex practices, the transgender community is not willing to convince them to use the preventive measures and safer sex practices. They are just willing to um, grab the money from the client. So they are not using the safer sex practices because of the limited clientele available.
Is there some sort of counseling provided for people dealing with stress?
Yes, we actually we have a community counselor. We have only one community counselor in our organization. We actually do organize some group counseling session in our drop-in center. So to provide them some counseling session, to provide them some psychosocial support. But this is the very limited services for them. The community is a very large, and we have very limited services for that. So more initiatives and more community counselors need to be hired, at least in the government treatment centers, so the community can get the basic psychosocial support to deal with their stress, and to have services from the centers to deal with their psychosocial support issues and all that.
Mhm. Final question, is there something you would like to share with the audience, a message or something you would like to address?
What we what I want to share with the public at large level, like this is the movement, this is the like kind of now time where we need to be together, and together we can make change. And through inclusive process, what I have seen and what I have experienced, always we can fight with any kind of situation. So we need to move together, and we need to join hands with each other. And this is the kind of recommendation from my side too. Like being a service provider, and being a service provider to providing services to the transgender community, what I want to say, like our transgender community are even more vulnerable due to the prejudice and stigma and discrimination against them. So we need to develop some COVID-19 preventive models, community-based models for the community, by keeping in mind the dynamics and issues of the transgender community they are facing during this situation.
Okay, thank you so much. It's very interesting. I can imagine why Salvin has a lot of respect for the work you do. He was very fond of you.
If you want to know anything else, just let me know, and just ask to Selvan to share my WhatsApp number with you. You can text me over there. I will respond you accordingly.
Okay, thank you so much, Monali. Take
Thank you so much. Thank you.
Bye.
Bye bye. Bye bye.